Okay, so think about this for a second.
So,
Globally, a shocking 60% of all deaths are due to chronic diseases.
wow,
That's a big number.
it is.
It's more than all infectious diseases, maternal and child deaths, and nutritional deficiencies combined.
Mm,
But here's the kicker. Up to 80% of heart disease, stroke, and type 2 diabetes could be avoided.
really?
80%.
That's amazing.
That's not just a small chance, that's an enormous power we might have over our own health.
Yeah.
And, it's something that affects so many people. It's a really widespread issue.
Yeah.
So today we're going to take a deep dive into what that 80% represents specifically for you.
I'm excited.
Welcome to the Deep Dive, where we take a really close look at important information just for you.
Great.
And today we're unpacking the core ideas behind lifestyle medicine based on some really fascinating material we have.
Sounds good.
Now, before we get started,
Yeah.
I want to give a big thank you to London Heartbeat Z Academy in the UK for their ongoing support in education.
That's great of them.
They have over 150 popular courses available.
Wow.
And if you're interested in learning more about health and well-being, I
Yeah,
really encourage you to check them out.
I will.
You can also find them on social media,
Okay.
Facebook, Instagram, and YouTube, where they share regular updates and have some great discussions lined up that you won't want to miss.
We'll be sure to check that out.
So the mission of this deep dive is pretty straightforward.
Okay.
We want to really understand how big the problem of chronic disease is,
Yeah.
what lifestyle medicine actually is,
Uh-huh.
what are the tools and the ways it works,
Okay.
and ultimately how it offers a very promising path forward.
Sounds good.
The goal is to give you clear, useful information that you can take away and think about without overwhelming you with jargon or too much detail.
Yeah, I like that.
Okay, so let's start by looking at the sheer scale of the chronic disease burden around the world.
Yeah, that's a great place to start.
Internationally,
Yeah.
chronic diseases are often referred to as NCDs,
I've heard that.
which stands for non-communicable diseases.
Right.
Meaning they aren't spread from person to person.
Mm-hmm.
And when you look at the global picture,
Yeah.
the numbers are truly significant.
Okay.
These NCDs are responsible for a massive 60% of all deaths worldwide.
Wow.
To put that in real terms,
Yeah.
that's about 35 million people dying each year from chronic diseases.
That's a lot.
Yeah, it's a huge number.
It is.
What's particularly striking is that this number is double the total number of deaths from all infectious diseases.
Really?
As well as deaths related to maternal and child health and nutritional deficiencies,
Hmm.
all added together.
Wow.
So double.
Yeah.
It really underscores just how dominant chronic diseases have become in terms of global health.
Absolutely.
That really puts things in perspective, doesn't it?
Yeah.
And it becomes even more compelling when you consider what the World Health Organization has to say about this.
Okay.
They've made a very strong statement about how many of these conditions could actually be prevented.
I'd be interested to hear that.
So according to the WHO,
Yeah.
if we were able to eliminate the well-known risk factors associated with these diseases,
Uh-huh.
we could prevent an astonishing 80% of heart disease, stroke, and type 2 diabetes.
Seriously.
And that's not all.
Okay.
They estimate that 40% of all cancers could also be prevented
Wow.
simply by addressing these modifiable risk factors.
It's a huge number.
Yeah, so that represents a huge amount of suffering and premature death that potentially could be avoided.
It really does.
So 80% of heart disease, stroke, and type 2 diabetes.
It's incredible.
That's incredible.
It is.
We're looking at a massive global health issue,
Yeah.
but with a huge opportunity for prevention.
Right.
So let's bring it closer to home and focus on the burden of heart disease.
Okay.
Specifically here in the U.S.,
Yeah.
the statistics are quite frankly startling.
I believe it.
So in the United States,
Yeah.
it's estimated that every 34 seconds, someone experiences what's called a coronary event, like a heart attack.
Yeah.
And tragically, approximately every 1 minute and 23 seconds, an American will die as a direct result of heart disease.
Wow. That's a scary statistic.
When you add up all the cases,
Yeah.
about 1 in every 6 deaths in the U.S. is linked to heart disease.
Wow.
That translates to a staggering 379,559 Americans dying each year because of this condition.
That's a lot of people.
And it's not just people having their first heart attack, is it?
No.
There are unfortunately many individuals who experience repeat events.
That's right.
So on an annual basis in the U.S.,
Yeah.
we see around 620,200 people having their very first heart attack. In addition to that, there are approximately 295,000 individuals who will experience a recurrent heart attack.
Right.
What's also quite concerning is the number of what are known as silent heart attacks.
Oh, yeah.
where people may not even realize they've had one,
Wow.
but damage to the heart still occurs.
That's scary.
And it's estimated that around 150,000 of those occur each year.
That's a lot.
So silent heart attacks.
Yeah.
That's a sobering thought.
It is.
So heart disease is clearly a major health challenge in the U.S.,
Absolutely.
and it sounds like it's an even bigger issue on a global scale.
That's right.
Cardiovascular disease, or CVD, is indeed the #1 cause of death worldwide,
Wow.
accounting for a massive 31% of all deaths globally.
That's crazy.
It truly represents a global health crisis that needs serious attention.
Yeah, it does.
Now, this is where the material we're looking at brings up something really interesting.
Okay.
Something that might even challenge some of our assumptions about treating heart disease.
Interesting.
We often hear about procedures like getting stents put in to open up blocked arteries,
Right.
but there are a couple of significant trials mentioned here. The Orbita and Courage trials.
Okay.
That suggest maybe those aren't always the most effective first line of defense.
I'd be interested to hear more about those.
Can you tell us about those studies?
Sure. So these were really important studies that cause a lot of discussion in the medical community about how we treat certain types of heart disease.
Subtle.
Yeah.
The Orbita trial, for example, was the first time a study looked at putting in stents, what's called percutaneous coronary intervention, or PCI,
Okay.
compared to a placebo procedure
Right.
in patients who had angina, which is chest pain caused by reduced blood flow to the heart,
Okay.
and also significant coronary artery stenosis, meaning their arteries were quite narrowed. And what they found was actually quite surprising.
Oh.
When they compared the group that received actual stents to the group that had a sham procedure where they went through the motions but didn't actually get a stent. There wasn't a significant difference in how long they could exercise.
Seriously?
Both groups improved, but the stent didn't offer a bigger benefit than the placebo when patients were also being treated with medication.
That's fascinating.
Yeah, it was a big surprise.
So physically opening up the artery with a stent didn't necessarily lead to them being able to exercise for a longer period compared to if they just thought they had the procedure. Exactly. That's amazing what the mind can do.
That's the key finding of the Orbita trial.
That's right.
And the Courage trial, which was conducted earlier, had similar implications.
Interesting.
It compared PCI to optimal medical therapy, which includes medications and lifestyle advice in patients with stable angina. And the findings suggested that for many patients, optimal medical therapy might be just as effective as immediately going for an invasive procedure like stenting in terms of preventing major cardiovascular events.
Interesting.
This led to a really powerful quote that's highlighted in our material.
Okay, what's that?
You can stent arteries, but you can't stent an unhealthy lifestyle.
Oh, wow. That's a good one.
It really emphasizes that while procedures can address physical blockages, they don't address the underlying lifestyle factors that often contribute to heart disease in the first place.
That's a really good point.
That quote really hits home.
It does.
And perfectly sets the stage for our discussion today about lifestyle medicine. So moving on from the significant burden of heart disease, let's talk about another major chronic illness, diabetes. And the material includes some data showing the prevalence of diagnosed diabetes here in the U.S.
Yeah, let's take a look.
Looking at the MAP data provided, we can see the age-adjusted prevalence of diagnosed diabetes among adults in the United States. And it varies quite a bit from state to state.
It does.
We see some areas of the prevalence of less than 4.5%. Then other states falling into the range of 4.5 to 5.9%. Followed by a 6.0 to 7.4% range. And sadly, there are also states where the prevalence is 9% or even higher.
That's a big range.
It's a big range.
Yeah.
It's worth noting that there was also some data missing for certain regions. But the overall picture clearly indicates a substantial burden of diagnosed diabetes across the country.
Right.
And it's not just those who have been officially diagnosed, is it?
No, it's not.
There's also the significant issue of prediabetes, where people have blood sugar levels that are higher than normal, but not yet high enough to be classified as type 2 diabetes. So when you combine the number of adults who have been diagnosed with diabetes with those who have prediabetes, the statistic becomes really alarming. Approximately 1 in every 3 adults in the United States has either diabetes or prediabetes.
That many.
That many.
That's a huge number.
It really is.
It is.
That's a massive portion of the population. that is either currently dealing with this chronic condition
Right.
or at a very high risk of developing it in the future,
Yeah.
potentially leading to serious long-term health complications.
Scary.
1 in 3.
Wow.
That's a truly sobering statistic.
Yeah, it is.
Okay, so we've looked at the significant impact of heart disease and diabetes.
Uh-huh.
The third major category of chronic disease we need to discuss is cancer.
Right. Let's talk about it.
What does the data tell us about its prevalence and impact?
Well, the numbers for cancer are also very significant. It's estimated that in the United States alone, around 1,700,000 new cases of cancer will be diagnosed every single year.
That many.
And tragically, cancer is responsible for a huge number of deaths annually.
Yeah.
Approximately 609,640.
Wow.
It remains a leading cause of mortality in the country.
It really is.
It is.
Those are incredibly high numbers.
They are.
But the material also mentions a rather hopeful statistic when it comes to the possibility of preventing cancer.
Oh, that's good. I want to hear about that.
According to the American Institute for Cancer Research, or AICR, it's estimated that a remarkable 50% of all cancers are potentially preventable.
Wow, really?
That's half of all cancer cases that might never develop if we address the known risk factors.
That's huge.
It really highlights the enormous potential that lies in preventive measures and lifestyle choices.
Absolutely.
Half.
Yeah.
That's another really powerful number that makes you think differently about how we approach cancer.
It really does.
It's not just about early detection and treatment, is it?
It's not just about that, no.
The material makes a very important point about the fact that within our bodies, cancer cells are constantly developing and being destroyed every day.
Right.
This natural process is usually kept in check.
Uh-huh.
It then raises a crucial question.
Okay.
Are we, as a society and as individuals, perhaps focusing too much of our attention and resources on just awareness of cancer and not enough on the absolutely critical aspect of prevention?
Yeah, that's a good point.
That's a really important shift in perspective.
It is.
Instead of primarily focusing on trying to find cancer in its early stages, shouldn't we be putting more emphasis on understanding and addressing the factors that contribute to its development in the first place?
Absolutely. I think that's key.
And when you look at the estimated percentage of cancer deaths that are attributable to well-established risk factors, it really reinforces the power of prevention.
Okay.
For example, tobacco use is linked to approximately 30% of all cancer deaths.
Wow.
Environmental pollution is estimated to contribute to around 2%.
Yeah. Socioeconomic status to about 3%.
Okay.
Prescription drugs and medical procedures to around 1%.
Right.
Reproductive factors to about 3%.
Uh-huh.
And perinatal factors and growth during early life to around 5%.
Yeah.
When you add all of these up,
Yeah.
it becomes clear that a significant proportion of cancer deaths are linked to factors that we can potentially influence through our choices and our environment.
That's a good point.
Okay, so we've established the significant global and national problem of chronic diseases.
Right.
And we've seen that many of them are indeed preventable.
Absolutely.
This naturally leads us to the concept of lifestyle medicine as a potential solution.
Okay, great.
What is it about lifestyle medicine that makes it so unique in addressing these issues?
Well, what's truly distinctive and remarkable about lifestyle medicine is that it stands out as the only medical discipline that, when implemented effectively, has a net negative cost associated with its interventions.
Really?
Think about that for a moment.
The primary tools and approaches of lifestyle medicine, things like making changes to your diet, engaging in regular physical activity learning, effective stress management techniques, are generally very low in cost.
Right.
And yet, they have an incredibly high impact on improving health outcomes and preventing and even reversing chronic diseases.
So a net negative cost?
Yeah.
It's a pretty compelling argument, not only from a personal health perspective, but also from an economic standpoint. When we look at the healthcare system as a whole,
absolutely,
it really speaks to the intrinsic power of these fundamental lifestyle changes.
It does.
And the material we're looking at emphasizes that for lifestyle medicine to be truly effective and have the greatest impact, it requires practitioners who are not only deeply knowledgeable about its core principles and the evidence behind them, but who are also personally committed to living and embodying those principles in their own lives.
That makes sense.
It's about leading by example and having a genuine firsthand understanding of both the challenges and the profound benefits that come with adopting a healthier lifestyle.
I agree.
That makes perfect sense.
It does.
It would be difficult to effectively guide someone else through these significant lifestyle shifts if you haven't explored and embraced them yourself.
Right.
So let's define this field more formally.
Okay.
What exactly is lifestyle medicine as a recognized medical specialty?
So lifestyle medicine involves the evidence-based application of lifestyle therapeutic approaches as a primary modality. These approaches predominantly include the adoption of a whole food plant-based diet, engaging in regular physical activity or exercise, prioritizing sufficient and restorative sleep, developing effective strategies for stress management, moderating or eliminating alcohol consumption, and completely ceasing all tobacco use. And it can also encompass other non-drug modalities as appropriate. The overarching goal of lifestyle medicine is to actively prevent, effectively treat, and often even reverse the many lifestyle-related chronic diseases that we've been discussing, such as heart disease, type 2 diabetes, and certain cancers.
So it's really about getting to the root causes of these chronic conditions.
That's exactly right.
Rather than simply managing the symptoms with medications or procedures, it's about addressing the underlying lifestyle factors that contribute to their development and progression.
Absolutely.
And when you consider the staggering statistic that 80% or even more of all healthcare spending in the United States is directly tied to the treatment of conditions that are fundamentally rooted in poor lifestyle choices. Things like hypertension, heart disease, stroke, type 2 diabetes, obesity, osteoporosis, and numerous types of cancer.
It's a big list.
It is. You really begin to grasp the enormous potential for lifestyle medicine to make a profound difference.
Absolutely.
Both in terms of improving individual and public health, as well as significantly reducing the economic burden on our healthcare system.
That's a great point.
80%.
Wow.
That's an astounding figure.
It really is.
And really underscores the critical importance of this approach.
Sure.
Where did the field of lifestyle medicine actually originate and gain recognition as a formal discipline?
Well, lifestyle medicine as a distinct and evidence-based field really began to take shape within the American College of Preventive Medicine. They recognized the overwhelmingly significant role that lifestyle plays in both maintaining health and contributing to the development of disease. You were instrumental in spearheading the development of the core principles and the evidence-based curriculum that now defines this important medical specialty. So for anyone who is interested in delving deeper into the foundational knowledge and understanding the scope of the field, the material we're looking at directs us to the website lifestylemedicine.org, which is a fantastic resource and hosts the Lifestyle Medicine Core curriculum.
Awesome. That sounds like an excellent resource for anyone who wants to learn more about the evidence and principles behind lifestyle medicine.
It is.
Now, the material specifically highlights an early and very influential pioneer in this field. Dr. Dean Ornish. He's widely recognized for some truly groundbreaking work.
Absolutely.
Particularly in the area of heart disease reversal. He was truly one of the first researchers to provide robust and documented scientific proof that heart disease, which was often considered a one-way street, could actually be reversed through comprehensive and intensive lifestyle changes alone.
That's amazing.
This was quite a revolutionary concept at the time.
It was.
And challenged a lot of the conventional medical thinking.
Yeah, for sure.
His research studies demonstrated some truly remarkable and encouraging outcomes in his patients who participated in his programs.
That's great.
What kind of outcomes did he observe in his studies?
Well, one of the most notable outcomes was that for the vast majority of his patients who followed his intensive lifestyle program, their chest pain or angina actually disappeared or significantly decreased.
Wow.
And perhaps even more astonishingly,
Yeah.
in about 82% of the participants in his studies, they observed a measurable reversal of the atherosclerotic plaques, the clogging in their coronary arteries.
Wow.
This wasn't just about slowing down the progression of the disease.
Right.
It was about actively making the arteries healthier and more open.
Actual documented reversal of the physical clogging in arteries through lifestyle changes alone.
That's right.
That's incredible.
It is amazing.
The material mentions that learning about his work was actually required reading for you during your medical school years.
Yeah, it was.
That must have been quite impactful and eye-opening.
It was really a game changer.
So what exactly did the plan entail?
Okay, so the plan was a very comprehensive and multifaceted approach that involves several key elements,
Yeah.
all implemented intensively over a sustained period, often around 5 years in his later studies.
Yeah, okay.
The dietary component was a very low-fat diet, with only about 10% of total calories coming from fat. This diet was based entirely on whole, unprocessed vegetarian foods.
Okay.
Participants also engaged in a significant amount of regular aerobic exercise, typically around 30 minutes of moderate intensity activity most days of the week. Crucially, the program also included dedicated stress management training, such as yoga and meditation. And participants were required to completely stop smoking.
Okay.
Finally, a key component that often gets overlooked but was very important was the element of group psychosocial support,
Okay.
where participants connected with each other and received emotional and practical support for making these significant lifestyle shifts.
That sounds like a pretty significant and comprehensive commitment from the participants.
It was.
What was the design of his research studies that allowed him to draw such strong conclusions?
The initial groundbreaking study ran for 1 year, and the results were so compelling that it was extended to 5 years to observe the longer-term effects of these intensive lifestyle changes.
Wow. Okay.
What they consistently found was that the experimental group,
Yeah.
the one diligently following the intensive lifestyle plan, actually showed a statistically significant decrease in arterial stenosis,
Okay.
which, as we discussed, is the narrowing of the arteries due to plaque buildup. In stark contrast, the control group, which received standard medical care at the time, typically saw a continued increase in this arterial narrowing.
So a real difference between the two
A
groups.
very real difference.
And were there also differences observed in terms of actual clinical events?
Yes.
Like heart attacks or the need for further interventions?
Yeah, there were.
What did they find?
Over the course of the studies, the control group receiving standard care
Yeah.
experienced about 12 times more cardiac events, such as heart attacks, strokes, or the need for bypass surgery or angioplasty,
Wow.
compared to the group that was adhering to the lifestyle plan.
That's a significant difference.
It is.
This really underscored the clinical significance and the real-world impact of these lifestyle changes,
Absolutely.
not just on the physical structure of the arteries, but on preventing serious health outcomes.
Right.
And he documented his findings
He did.
and the details of the plan in his influential and widely read book, Prevent and Reverse Heart Disease.
That's a good one.
Now, the material we're looking at even makes a reference to some visual evidence of this remarkable reversal.
Okay.
It mentions some specific publications.
Right?
Yes, the material references images that were published in the Journal of Family Practice in July 2014,
Okay.
and also highlights the website dresselston.com,
Okay.
which features similar visual evidence.
Uh-huh.
These images are incredibly powerful because they visually demonstrate the restoration of myocardial perfusion,
Right.
which is the flow of blood to the heart muscle, and the actual regression or reversal of coronary artery disease as seen through angiography before and after individuals followed these intensive lifestyle interventions.
Wow.
It's one thing to read the statistics,
Yeah.
but seeing the physical changes in the arteries is really quite compelling and makes the potential of lifestyle medicine much more tangible.
It really does.
Absolutely. As the saying goes, seeing is often believing.
Right.
And those visual examples must have been incredibly impactful for both the medical community and the public.
For sure.
So we now have a good understanding of what lifestyle medicine is,
Yeah.
the significant problem it addresses,
Uh-huh.
and some powerful early evidence of its effectiveness.
Right.
Let's move on to the practical aspects.
Okay.
What are the specific tools and approaches that are utilized within the field of lifestyle medicine to help people make these changes?
So lifestyle medicine utilizes a diverse range of tools and strategies,
Okay.
which can be broadly categorized into those typically employed by medical professionals and the contributions of a wider multidisciplinary team of other health and wellness professionals.
Right.
It's really a collaborative approach.
So let's start by focusing on the medical tools.
Okay.
What are some of the key techniques and strategies that healthcare providers use in the practice of lifestyle medicine?
One of the foundational medical tools in lifestyle medicine is the technique of motivational interviewing.
Okay.
This is essentially a specific way of having a conversation with a patient that focuses on understanding their own intrinsic motivations for change. The goal is to guide them to develop their own personalized plan for adopting healthier behaviors based on what is important to them and what they genuinely want to achieve, rather than simply telling them what they should do.
Right.
It's about fostering a sense of ownership.
Yeah.
and empowering them to make sustainable changes that align with their values and goals.
So helping them move towards what they already desire.
Yeah, exactly.
Making them feel like the ideas and the drive came from within themselves.
That's right.
That sounds like a much more effective and sustainable approach than simply lecturing or prescribing behaviors.
I think so too.
It's about partnership and understanding the individual's perspective.
Absolutely.
Another valuable tool is the implementation of group medical visits.
Okay.
This involves bringing together a group of typically around 10 to 20 clients who share similar health concerns or goals,
All right.
along with a trained facilitator, often a healthcare provider.
Okay.
These sessions usually last for about an hour and a half and follow a structured educational curriculum that addresses various aspects of lifestyle change.
Okay.
What's also practical about this model
Yeah.
is that these group visits can often be billed as regular office visits,
Right.
making them a more efficient way to deliver lifestyle education support and foster a sense of community among participants.
That makes sense.
That's an interesting model that seems to offer both educational benefits
Yeah.
and the power of peer support within a healthcare setting.
Absolutely.
Then there's the approach of intensive lifestyle treatment, or ILT.
Okay.
This typically involves more frequent and individualized one-on-one meetings between a client and a healthcare provider or a trained lifestyle coach,
Right.
often occurring every 1 to 2 weeks.
Okay.
These sessions provide ongoing tailored support guidance and accountability as the individual navigates their journey of lifestyle change.
Right.
For some individuals who may need a more immersive and comprehensive level of support. There are also residential treatment programs where they essentially live in a supportive environment that fully immerses them in a program of lifestyle modifications.
That's interesting.
So it sounds like there's a spectrum of intensity when it comes to the delivery of lifestyle medicine interventions.
That's right.
Ranging from group settings
Right.
to very personalized and immersive programs.
Yeah.
Now, you mentioned that a wider multidisciplinary team is often involved. Who are some of the other professionals that typically contribute to a comprehensive lifestyle medicine team?
So a truly effective and comprehensive lifestyle medicine team often brings together expertise
Okay.
from a variety of different healthcare and wellness disciplines.
Uh-huh.
This can include physician assistants, and nurse practitioners
Okay.
who often play a central role in leading and coordinating the team.
Right.
Registered dietitians are absolutely crucial
Yeah.
for providing evidence-based and personalized nutritional guidance.
Makes sense.
Personal trainers, physical therapists, and occupational therapists contribute their expertise in exercise, prescription movement therapy,
Okay.
and helping individuals overcome physical limitations.
Uh-huh.
Yoga Tai Chi and mindfulness instructors offer valuable skills and practices for improving physical flexibility, balance, and stress management.
Right.
Wellness coaches and nutritionists can provide ongoing support, education, and motivation. In some settings, a culinary medicine chef may be part of the team
Wow.
to teach practical and healthy cooking skills.
That's interesting.
Finally, health psychologists and practitioners of mindfulness-based stress reduction can address the important psychological and
All right, welcome back to the deep dive. Today we're going to be talking about lifestyle medicine, which I think, it's a really important topic because instead of just treating diseases after they pop up, lifestyle medicine is all about taking a proactive approach to preventing those chronic diseases in the first place, getting to those root causes, right?
That's right, yeah. And a big part of lifestyle medicine is this framework that we call FORKS, feet, fingers, stress, sleep, love.
I like that.
It's catchy.
It is catchy, yeah. So it's basically looking at, it's pretty straightforward, right? It's what we eat, how much we move, things like smoking and drinking, how we manage stress, are we sleeping enough? And the quality of our relationships as ways to build good health.
Yeah, all those foundational pieces.
Exactly. And today we're going to do a deep dive into each of those core parts. We've got a lot of information in front of us, so we're going to dig in and try to pull out those really practical insights for you guys, the listeners, to actually apply to your own lives and hopefully feel better, live healthier, right?
That's the goal.
So let's start with forks and jump into plant-based nutrition. That's a big one.
Okay, so when we talk about nutrition and lifestyle medicine, a plant-based diet really is a core recommendation. And it's interesting to look at how our eating patterns in the U.S. have changed over time. If we look back at the estimated average consumption from 1970 compared to 2017, and we put those numbers next to the 2015 to 2020 dietary guidelines, some pretty clear trends pop up.
So what are we seeing here? I mean, what really jumps out at me is the difference in how much meat and eggs people were eating compared to like grains, nuts, vegetables, dairy, fruit. Back in 1970, it looks like folks were eating a lot more meat and eggs than those dietary guidelines recommended. And even though our diets have shifted some by 2017, it still seems like a lot of people are eating more meat and eggs than is ideal. And then when you look at grains and nuts, vegetables, dairy, fruit in 2017, it's moving in the right direction, but there's still some room for improvement, I think. So the takeaway here is that our diets are changing, but maybe not always in the ways that are best for our health, especially in the long run.
Yeah, and if we really want to see how things have shifted with meat, we can look at meat availability. And by availability, we mean what's out there for people to consume. We've got data on how much beef, pork, chicken, and fish and shellfish was available per person in the U.S., going all the way back to 1910 and up to 2017. And you can see some interesting trends. Like beef availability has actually been going down for decades.
Really? Interesting.
Yeah, while the amount of chicken that's available has been going up, 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 pork and fish and shellfish availability have kind of gone up and down over time. But these changes probably reflect a bunch of different things, like changes in people's preferences, how we're producing food, and economic stuff affecting the food market.
It's like a snapshot of how our food landscape is always changing.
Yeah.
And speaking of changing, let's talk about sweeteners. The data on how much caloric sweetener was available per person in the U.S. from 1970 to 2017, it's kind of crazy. The total amount has gone way up. And what's really interesting is the split between refined cane and beet sugar and corn sweeteners. Like corn sweeteners have become a huge part of added sugars in our diets now. So that shift, makes you think about what it means for our health. Yeah. All that extra sugar, it can impact our metabolism and our overall calorie intake.
Yeah, definitely. And when you look at our overall food consumption, like the percentage of calories coming from different sources, the contrast between plant-based and animal-based foods is pretty big. I mean, plant-based foods like vegetables, fruits, corn, nuts, and seeds, whole grains, they make up a good chunk of our calories. And animal-based foods, the meat, dairy, eggs, fish, seafood, they also contribute a lot. But we have to remember, there are some key differences between these two categories, like cholesterol. You only find that in animal foods. And dietary fiber, you only get that from plants. Plus, a lot of the saturated fat in our diets comes from animal foods, too.
And don't forget, a lot of those foods in both categories, plant-based and animal-based, can be really processed, like those fruit snacks with tons of added sugar, or processed meats with all that sodium and preservatives. Those kinds of processed options often don't give you the same health benefits you get from eating whole, unprocessed foods. So the real takeaway here is to focus on those whole foods, like fresh vegetables, fruits, legumes, nuts, seeds, whole grains, whether you're eating more plant-based or including some animal products.
Right. It's about choosing those minimally processed options. And that actually leads us to a simpler way of thinking about healthy eating, something that's easier than all those complicated food pyramids and stuff.
Yeah, sometimes those can get a little confusing, honestly.
Definitely. This guide to healthy eating, it's really straightforward. Basically, it says eat less from the animal and processed food groups and eat more whole foods from the plant food group.
That's a lot easier to visualize, that's for sure.
It's a clear visual that makes it easy to understand.
I like that. Okay, let's talk about something we hear a lot about, especially with plant-based diets. Fiber. On average, people in the U.S. are getting about 15 grams of fiber a day if they're women and 18 grams if they're men. But the thing is, most people in the U.S. aren't actually getting enough fiber based on the recommendations. And like we talked about, fiber only comes from plants. So it seems like there's this big gap between how much fiber we should be eating and how much we actually are.
Yeah, and the benefits of fiber are huge. Like fiber helps control blood sugar levels, which is super important for preventing and managing type 2 diabetes. Plus, it makes you feel full and satisfied after you eat, which can help with weight management. And if you look at data from NAAN's, the National Health and Nutrition Examination Survey from 2009 to 2010, it's clear that lots of people in the U.S. are just not eating enough fiber. It's a serious issue, and it's connected to all sorts of chronic diseases.
I feel like whenever plant-based nutrition comes up, the question that always follows is, but where do you get your protein? It's like the go-to response, right?
Oh, absolutely. Such a common question. But it's important to address it with accurate information. We tend to put a lot of emphasis on protein, especially protein from animals. But if you really look at the research, animal proteins can have some not so great effects on the body. For example, they can raise cholesterol levels, which increases your risk of heart disease.
Oh, wow. I didn't realize it was linked to that.
Yeah. And some studies have even linked animal protein to a higher risk of osteoporosis because of how it affects calcium. It can also increase certain growth hormones, which may not be good in certain situations, like if you're dealing with cancer. And there are even links between animal protein and Alzheimer's disease, gout, and kidney stones.
Wow, that's a lot to think about. So, what about protein from plants? What's the story there?
Well, generally, plant proteins tend to do the opposite in many of these areas. If you're eating a well-planned, plant-based diet with a variety of different foods and enough calories, you're going to get enough protein. Most people really don't have to worry about a protein deficiency on a plant-based diet, especially if they're eating enough calories overall. But remember, it's not just about protein. It's about all the nutrients that come along with it. Plant-based protein sources like beans, lentils, tofu, nuts, seeds, they also have fiber, vitamins, minerals, antioxidants. So it's not just about hitting a certain protein number. It's about the quality of the food and all those other things you're getting too.
I love how you said that. It's not about isolating one nutrient, it's about the whole package. And when you actually compare plant-based and animal-based foods side by side, looking at data from the USDA nutrient database, the differences are pretty amazing. Even if you compare the same number of calories, like let's say 500 calories worth.
Right. Like, let's take 500 calories of raw spinach and red tomatoes, which are plant-based, and compare them to 500 calories of ground beef, pork, chicken, and dry whole milk, which are animal-based. The spinach and tomatoes have 0 cholesterol, while the animal foods have about 197 milligrams. And the fat content is also pretty different. The plant-based options usually have less total fat and a healthier ratio of unsaturated to saturated fats. Now, the protein levels can be similar depending on the specific foods you choose, but the fiber is where you see a huge difference. Those 500 calories of plant-based foods would have about 31 grams of fiber, while the animal-based foods would have, well, none.
It's fascinating how different they are, even with the same calories. What about other nutrients like vitamins and minerals?
Yeah, there are big differences there too. In that same 500-calorie comparison, plant-based foods usually have way more vitamin C, iron, calcium, beta-carotene, vitamin E, folate, and magnesium. So you get a bigger bang for your buck, nutrient-wise, when you choose plants. It's really about getting the most nutrients possible for the calories you're eating.
And that's why plant-based foods are often considered the best fuel for our bodies, right? They're not just empty calories, they're full of nutrients. They can help fight inflammation. They protect us from oxidative stress. And a lot of people even find that they have more energy and perform better when they eat more plants. Plus, there's all that research about plant-based diets and their role in reducing the risk of cancer and heart disease, and even helping treat those conditions.
Exactly. It's the more pharmacy, less pharmacy idea.
I love that. Focusing on food as medicine. So, for someone who wants to try eating more plant-based, what are some basic guidelines to keep in mind?
The Power Plate guidelines are pretty useful. They basically divide your plate into 4 sections, and they emphasize fruits, vegetables, whole grains, and legumes like beans, lentils, peas. Make those the stars of your meals. And try to limit added fats, especially those from processed oils and animal products. Choosing foods with a lower glycemic index like non-starchy vegetables, berries, oats, lentils can also help keep your blood sugar stable. And aiming for about 40 grams of fiber per day is a good goal for most people.
Sounds like a pretty clear and balanced approach. Now, I know some people worry that a mostly plant-based diet won't be healthy or provide enough nutrients. What do major nutrition organizations say about that? Like, what about vegetarian and vegan diets?
Well, the Academy of Nutrition and Dietetics, which is the largest group of nutrition experts in the U.S., they've made it clear that well-planned vegetarian diets, including vegan diets, are totally healthy, provide all the nutrients you need, and can even help prevent and treat some diseases. They say these diets are good for people of all ages, from babies to older adults. They even point out that plant-based diets are better for the environment. And people who eat vegetarian or vegan tend to have a lower risk of heart disease, type 2 diabetes, high blood pressure, some cancers, and obesity.
That's reassuring to hear.
The one thing they do say is that vegans need to be sure they're getting enough vitamin B12 because it's mainly found in animal products. But overall, the Academy is really supportive of plant-based diets.
And it's interesting to look back at some of the earlier research that supported a low-fat and high-carb way of eating, because that often aligns with a plant-based approach, right?
Yeah, absolutely. Like there was Dr. Walter Kempner and his rice diet program back in the 1930s and 40s. His research showed some pretty incredible benefits from a low-fat, high-carb diet, mostly rice, fruit, and sugar, for people with diabetes and heart problems. Later on, researchers like Dr. James Anderson found that high-carb, high-fiber diets were really effective for controlling blood sugar and reducing insulin needs in men with diabetes. And then there was Nathan Pritikin, who was a big advocate for a very low-fat, high-fiber diet, mostly plant-based, for treating type 2 diabetes and other chronic diseases.
And it's not just old research, is it? Like, there are newer studies that are finding similar results.
Oh yeah, tons of research is still coming out all the time that supports plant-based diets. For example, Dr. Neil Barnard's work has shown that a low-fat vegan diet can really improve blood sugar control and other heart health markers in people with type 2 diabetes. And big population studies, like a Rotterdam study, which followed a ton of people over a long period, they've also found that eating more plant-based foods is linked to a lower risk of insulin resistance, pre-diabetes, and type 2 diabetes. So the research is really piling up.
So when we talk about lifestyle therapy for people who are at risk for complications from diabetes, where does nutrition fit in?
It's central, really. The typical recommendations include getting to a healthy weight, which might mean cutting back on calories if someone has a high BMI. And diet-wise, it's really important to avoid trans fats altogether and to limit saturated fat. Instead, you want to focus on those healthy fats, the polyunsaturated and monounsaturated kinds, like what you find in avocados, nuts, seeds, olive oil. And having some structured nutrition counseling, like from a registered dietitian, is really important too. Sometimes meal replacements might even be helpful as part of a plan to get people on track with their nutrition and manage their blood sugar.
Okay, that sounds pretty comprehensive. Now, I'm curious about this four-leaf survey that we have in our materials. What is that exactly, and how does it tie in with all this plant-based nutrition stuff?
So the four-leaf survey is a quick little assessment, takes about 2 minutes, and it estimates what percentage of someone's calories are coming from whole, unprocessed plant foods. It's a really simple way for people to get a sense of their eating habits and see if they could be eating more plant-based foods.
Okay, and how does it work? What kinds of questions does it ask?
It's 12 simple questions about what you typically eat in a day or a week. You get plus points for each serving of fresh fruits, whole veggies, not including white potatoes, and whole starches like sweet potatoes, whole grains like brown rice and quinoa, and legumes, beans, lentils, peas. And then you get minus points for each serving of dairy, liquid dairy like milkshakes, eggs, added sugars, white flour foods, salty snacks and sweets, meat, beef, pork, lamb, game meats, poultry, fish, and vegetable oil.
So basically, you add up your pluses, subtract your minuses, and that gives you a score.
Exactly, and that score corresponds to one of 4 leaves, hence the 4-leaf survey. Each leaf represents an estimated percentage of your calories coming from whole plants.
I see. That seems like a pretty easy and quick way to get a general idea of how plant-based someone's diet is.
Right. And in a clinical setting, it can be a really good starting point for conversations about making healthy changes. It helps people become more aware of what they're eating without being judgmental, and it can motivate them to make changes on their own. When they see it laid out like that, it can be kind of eye-opening. It can also help build trust between the healthcare provider and the patient. Plus, it can help pinpoint some areas where even small changes could make a difference, or it can encourage people who are already thinking about making bigger changes.
Makes sense. It's about getting the conversation started and empowering people to take charge of their own nutrition. Now, for healthcare providers who might be thinking about using this survey, are there any billing considerations for nutrition analysis and counseling?
Yeah, there's a specific billing code for that 99401. It's for preventive medicine, individual counseling, and it's usually for sessions that are about 15 minutes long. But there might be some payment restrictions depending on the insurance plan. Sometimes it's covered by private insurance, but not by government insurance, for example. It's also usually billed on top of a regular E&M code, so it's not just a preventive care code on its own. The WRVU for this code is 0.48, which basically reflects how much work the doctor is doing. And generally, you need at least 8 minutes of face-to-face counseling time to bill for this code.
Okay, so it's important to keep track of the time and document everything properly.
Absolutely. Make sure you document the time you spent, what you talked about during the nutrition assessment and counseling, and how the patient is doing. And always double-check with your billing department and insurance plans to make sure you're following all the rules. And there are also some ICD-10 codes that might be relevant, like Z71.3 for diet and nutritional counseling, and Z71.82 for exercise counseling.
So, lots to keep in mind.
But it's worth it to be able to offer this kind of service to patients.
Absolutely. All right, let's move on to feet, the next part of the lifestyle medicine framework, which is all about exercise. So what are we aiming for here? How much exercise should we be getting?
The general recommendation is to get at least 150 minutes of moderate intensity aerobic exercise per week, Or if you're doing vigorous intensity exercise, you can aim for 75 minutes a week. And of course, the more you can do beyond those minimums, the better. Some experts even suggest aiming for closer to 300 minutes of moderate intensity or 150 minutes of vigorous intensity per week for even bigger health benefits. On top of that, you also want to try to do some muscle strengthening activities that work all your major muscle groups, at least 2 days a week. That combination of aerobic exercise and strength training is the best way to stay fit.
So if someone wants to start exercising more, how can they create a plan for themselves? Or if a healthcare provider wants to help their patient get started, how can they go about that?
The FITT principle is really helpful for that. FITT stands for frequency, intensity, time, and type. Okay, break that down for us.
Sure. So frequency means how often you exercise, and most adults should aim for 3 to 5 days a week. Intensity is how hard you're working. And for aerobic exercise, you usually want to be at about 60% of your maximum heart rate, although paying attention to how hard it feels can also be a good guide. Time is just how long each exercise session lasts, and most guidelines suggest 30 to 60 minutes of aerobic activity on those days. And then type is the specific kind of exercise you do.
Give us some examples.
Absolutely. So for aerobic exercise, you could use a treadmill, go cycling, swim, or even just walk briskly. For strength training, you can use light weights, resistance bands, or even just your body weight, like in yoga or calisthenics. And stretching can be things like yoga, tai chi, or just regular stretches to improve your flexibility. And you can even do combination workouts that mix all these types together.
Okay, so lots of options.
Exactly. And by using the FITT principle, people can put together an exercise plan that works for them and helps them reach their goals. All right, let's talk about fingers now, which is all about smoking and drinking habits. These are really big ones, right?
Definitely. And the statistics are pretty shocking, honestly. In the U.S., about 480,000 people die every year because of smoking-related illnesses. And alcohol is responsible for about 80,000 deaths annually. It's a huge public health problem, and the costs are immense, something like $300 billion every year just in the U.S.
Wow. I knew it was bad, but those numbers are really serious. And the health problems linked to smoking, I mean, the list just goes on, doesn't it?
It really does. We're talking over 40 different types of cancer, and smoking causes almost a third of all cancer deaths. And it's not just cancer. Smoking also increases your risk of type 2 diabetes, rheumatoid arthritis, stroke, heart disease, COPD, you name it. It messes with your immune system, causes problems with fertility, makes it harder for wounds to heal, raises the risk of HPV-related diseases, can cause vision loss, makes you more likely to break bones, can lead to chronic muscle pain, and is often linked to other addictions.
I mean, that's a pretty scary list.
It is. But there is hope for people who want to quit. There are great resources out there, like the quityes.org website and their helpline 1-866-QUIT-YES. So, for anyone struggling with this, there is help available.
So what can healthcare providers do to help patients quit smoking? I remember learning about the 5 A's as a strategy.
The 5 A's are a really effective approach. Basically, it's a framework to help healthcare providers guide their patients through quitting. First, you need to figure out if each patient uses tobacco at every visit. Then, give clear and personalized advice to every tobacco user, encouraging them to quit. Then you assess, see how ready they are to make a quit attempt. Then you assist if they're ready to quit, offer counseling, and recommend things like nicotine replacement therapy or other medications that can help. And lastly, arrange scheduled follow-up appointments, maybe a week before they plan to quit, and then again a few days after, just to offer support and keep them on track.
That's a really proactive approach. I like that. Okay, what about alcohol? What are the main things to consider when we're talking about lifestyle medicine and overall health?
Well, alcohol use disorder is a really big problem. About 17 million adults in the U.S. have it, and another 26% are considered at-risk drinkers or have a mild form of the disorder.
So catching it early is key, right?
Absolutely. And there are some great screening tools out there that can help, like the IED-ITC is a quick test that focuses on how much someone drinks, and the full IED-IT questionnaire is available on drugabuse.gov. These tools are really helpful for healthcare providers to figure out if someone might be struggling with alcohol and if they need more help.
So regular screening and brief interventions are important both for smoking and drinking to help people move towards healthier habits.
Absolutely. And speaking of healthy habits, let's shift gears to sleep now. It seems like in our busy lives, sleep is one of the first things to go, right?
Oh, totally. It's easy to sacrifice sleep when we're feeling stressed or overwhelmed.
Yeah, it's like sleep has become this inconvenient thing, like it's wasted time. But the reality is that not getting enough sleep can have serious consequences. About 20% of adults in the U.S. say they regularly sleep less than 6 hours a night. And for young adults, That number is even higher. 37% get less than the recommended 7 hours. Plus, about 10% of adults in the U.S. have actually sought medical help for sleep problems, so it's a pretty widespread issue.
And not getting enough sleep, I mean, it affects everything, right?
It really does. It can mess with your thinking, your mood, your physical performance, your immune system, your metabolism. I mean, you name it, it's probably affected by sleep. Our sleep-wake cycle is mainly controlled by our circadian rhythm, which is like our internal clock. And that clock is affected by things like light, when we eat, how much we drink, and our body temperature. When that rhythm gets disrupted, it can cause all sorts of problems. Plus, there are common sleep disorders like obstructive sleep apnea, insomnia, and periodic limb movement disorder, which can make things even worse.
So how can people improve their sleep?
Well, there are a lot of different options, depending on what's causing the sleep problems. Some non-drug approaches include guided imagery and CBTI, which is cognitive behavioral therapy for insomnia. That type of therapy focuses on changing how you think and act when it comes to sleep. And there are also things like certain herbs, essential oils, calming teas, regular exercise, but not too close to bedtime, and mindfulness meditation. The important thing is to figure out what's causing the problem and then find the right solutions for that person.
That makes sense. And I also read that there's a connection between lack of sleep and accidents, like car accidents and things like that.
Absolutely. When you're not getting enough sleep, your reaction times are slower, your judgment isn't as good, and you can't focus as well. All of those things make accidents more likely, whether you're driving, at work, or even just walking around. So getting enough sleep isn't just about your own health, it's about public safety too.
All right, let's dive into stress now.
Oh, yeah, everyone's favorite topic, right?
I feel like it's unavoidable these days.
Yeah, and a lot of people end up going to the doctor for stress-related problems.
Mm-hmm.
It's estimated that around 70% of primary care visits are connected to stress and lifestyle issues. So clearly, our mental and emotional state and our daily habits, they have a big impact on our physical health. And the thing is, stress and healthy habits, they kind of feed off each other.
What do you mean?
Well, when you're really stressed, it's harder to eat well, exercise, get enough sleep. And on the other hand, when you do those healthy things, you're usually better at handling stress and your mood is better overall. So it's a cycle.
So it's all interconnected, mental and physical health. Is there a way to measure how stressed someone is, to figure out who might need extra help?
Yeah, there are a few tools for that. One is the Perceived Stress Scale, the PSS. It's 10 questions, and it asks about how you've been feeling and thinking in the past month related to stress. The score helps figure out if someone has low, moderate, or high levels of stress, and if they might benefit from some help managing it.
So what kind of questions are on the scale?
Well, it asks things like, how often in the past month have you felt upset because something unexpected happened? Or how often have you felt like you can't control the important things in your life? It also asks how often you felt nervous and stressed, how confident you are about handling your personal problems, how often things have been going your way, if you've felt like you can't cope with everything you have to do, how often you've been able to control annoying things in your life, if you've felt on top of things, if you've been angered by things outside your control, and if you've felt overwhelmed by everything you have to do.
So it covers a lot of ground in just 10 questions. And speaking of mental health, how does that play into our overall health and well-being?
Mental health is a really big factor, actually. Research shows that depression can double your risk of having a heart attack. And bad mental health can also lead to physical changes in the body that can contribute to disease, like problems with blood vessels, lower heart rate variability, and increased blood clotting. Plus, it often leads to making unhealthy lifestyle choices.
And it can work the other way around too, right? Like having a chronic illness can make you more likely to be depressed.
Exactly. It can become a vicious cycle. Because of that connection between mental and physical health, it's a good idea for doctors to do some basic mental health screenings. Like the PHQ-2 is a really simple 2-question screening for depression.
Okay, so what are those questions?
It asks how often in the past 2 weeks you've been bothered by feeling down, depressed, or hopeless, and how often you've had little interest or pleasure in doing things.
So really simple, but potentially really helpful for catching problems early.
Definitely. And if someone does seem to be struggling, then they can get more in-depth help. Now, going back to stress, what are some ways to manage it that don't involve medication? Things that lifestyle medicine recommends. Mindfulness is a big one. It's about becoming more aware of your thoughts, feelings, and body sensations in the present moment without judging yourself. It's about paying attention to your experience, but with an attitude of acceptance, Even just practicing mindfulness for 10 minutes a day can make a big difference in how you handle stress and how you feel emotionally.
So how can people learn mindfulness?
Well, one popular program is mindfulness-based stress reduction, or MBSR. It's usually a group program that meets for a few weeks, and it teaches people how to practice mindfulness through meditation, body scans, and gentle movement.
Okay, and are there ways to learn it if you can't go to a class?
Absolutely. There are tons of free online MBSR courses through places like Coursera, Universitat Leiden, and academy.happiness.com, so you don't even have to leave your house to learn.
That's amazing. So accessible. Now, I noticed in our materials they talked about something called Zen mindfulness of the ordinary. What is that all about?
It's basically about bringing mindfulness into your everyday life, like paying attention to simple, routine things that you normally do on autopilot. For example, when you're turning on the water, instead of just doing it mindlessly, you could really focus on what you're feeling. The faucet handle in your hand, the sound of the water, how the water feels on your skin. And you can even think about where the water came from and its journey to get to you.
So it's about appreciating those everyday moments.
Yeah, and finding mindfulness in them. Another example is washing your hands. You can turn that into a mindful practice by paying attention to the feel of the water and soap, the movements of your hands, and the purpose of what you're doing. These little things can help you feel more present throughout the day, even when you're just doing regular things. It's like finding pockets of peacefulness in your everyday life.
I love that. Okay, we've reached the last part of the framework. Love. It might seem a little out of place in a conversation about health, but it's clearly important.
It is. In lifestyle medicine, we think of love as compassion, basically. It's about being kind, friendly, and gentle with yourself and others. And it's also about the importance of having loving, caring relationships, close connections with family and friends, and being part of supportive communities. These connections are really crucial for healing, both physically and emotionally.
We need those connections to thrive, that's for sure.
Exactly. There's this saying, alone we go faster, together we go farther. And research has shown that having strong social support is good for both our mental and physical health. Plus, showing compassion to others isn't just good for them, it's good for us too. It can even lead to better outcomes in healthcare settings. And things like cultivating a healing presence as a healthcare provider and practicing gratitude are also part of this love domain. It's all about recognizing that our social and emotional lives are deeply tied to our physical health.
It really completes the picture of lifestyle medicine as a truly holistic approach.
Exactly. It's about the whole person, not just their physical body.
All right, so for healthcare professionals who are listening and want to learn more about lifestyle medicine, what are the options for getting certified?
Well, there are certifications for all sorts of healthcare professionals, from those with PhDs and master's degrees to licensed practitioners like nurse practitioners, physician assistants, optometrists, podiatrists, chiropractors, naturopaths, psychotherapists, exercise physiologists, occupational therapists, pharmacists, physical therapists, speech-language pathologists, psychologists, dentists, and of course, medical doctors. For medical doctors, they can become certified as either lifestyle medicine physicians or lifestyle medicine specialists, depending on their experience and training.
So what do you need to become certified as a general lifestyle medicine professional?
It usually requires a doctorate or master's degree in a health-related field. This could be something like nutrition, exercise science, public health, health education, behavioral health, or clinical doctorates like a doctor of nursing practice, DNP. Physician assistants who are licensed and certified can also get certified, as can doctors of optometry, podiatry, chiropractic, as long as they're from an accredited program, naturopathy, but only from an ANMC accredited program, psychotherapy, exercise physiology, occupational therapy, pharmacy, physiotherapy, psychology, and dentistry. There might be some extra requirements too, depending on the specific profession and the certifying organization, but generally, it's about having that educational foundation in a health-related field.